Ladies and gentlemen, friends from the media, good afternoon. Welcome to the press conference organized by the Information Office by the Government of Guangdong Province during President Xi's field trip to Beijing. He also emphasized that we have to mobilize all resources to focus on the scientific and technological areas in order to provide a strong support to win the battle against COVID-19. Recently, we have deployed all departments of Guangdong Province to form a strong synergy to ensure that we can implement the scientific and technological work in an orderly manner. So today, once again, we have this press conference to update on the epidemic situation. And also, we will focus on the latest development of the science and technology in fighting against the COVID-19. First, I would like to introduce our speakers. Academician of Chinese Academy of Engineering, Mr. Zhong Nanshan. Deputy Head of Department of Science and Technology, Mr. Gong Guoping. And Vice Chairman of the Provincial Health Commission, Ms. Zhou Zixiao. And President of the 3rd Renmin Hospital of Shenzhen Province, Mr. Liu Lei. Mr. Lin Tianxing from Vice President of Sun Yat-sen Memorial Hospital. And Mr. Wu Guangming, the researcher at the Guangzhou Regenerative Medicine and Health Guangdong Laboratory. First of all, let's give the floor to Ms. Zhou Zixiao. Friends from the media, good afternoon. Yesterday, Secretary Li Xing has organized a meeting on the prevention and control of COVID-19. Also, he passed on the spirit of General Secretary Xi Jinping and also passed his spirit in fighting against COVID-19 during his field trip in Wuhan City.
全省累计报告新冠肺炎确诊病例1356例，累计出院1292例，累计死亡8例。10日当天
First of all, I will give you some update on the epidemic situation in Guangdong Province.
深圳市报告1例法国输入病例，中山市报告2例西班牙输入病例。12日0到12时无新增确诊病例，新增出院4例，有345名密切接触者正在接受医学观察，现有在院56例。
1 imported cases in Shenzhen, 2 imported cases in Zhongshan City.
确诊病例数维持在个位数。
No new confirmed cases on March the 12th.
无新增确诊病例，占比96.09%。云浮一直为无确诊病例，珠海、韶关、河源、惠州、汕尾、江门、阳江、湛江、茂名、肇庆、清远、潮州、揭阳、梅州等14地市在院的确诊病例全部出院。当前，新冠肺炎在全球多点爆发并呈现蔓延的态势，部分国家的疫情还比较严重。我国累计报告境外输入确诊病例85例。我省自3月6日以来无省外及本地病例，但累计报告6例境外输入病例，提示我省防境外输入的风险增大。在这里再一次提醒公众，赴境外人员要按照防控指引的要求，落实各项防控措施，做好个人
Since on March the 6th, we have no
已越
imported
过返
cases.
粤的各位人士，
We have 6 imported cases,
如有不适
and
症状，
meaning
请
that we
自觉
have
申
a
报
higher risk of imported
配合做好
infection.
入境检疫等工作。如实申报工作非常重要。从昨天深圳报告的境外输入病例可以看出，一位患者如实申报的健康
Please
状
fill in
况，
the
一
health
到达口岸就
certificate
进行了
if you
规范
feel
化的处置，
not well,
患者本
please
人也
report
得到
to
了
the
及时的
government.
救治，同时也尽可能减少了密切接触者，最大程度地保护了家人、朋友、同事等周边人的安全。
So we can protect the safe of our family members. Now I would like to give you some update of the epidemic situation. The community's prevention and control is of a top priority with the consumption of work and production. Many people are coming back to Guangdong province from other cities, for example, communities, villages, and other areas. And we also have a high risk of infection. In order to take targeted measures against the prevention and control in those areas, we have released several documents so that we can provide more strict measures.
建立县级统一指挥、镇街组织协调实施村居为作战单元的责任体系，压实各镇街党委政府、村居委防控主体的责任，落实网格化管理，落实重点人群管理措施，落实联防联控机制，要求加强排查，通过粤康码的推广应用，引导疫情重点地区来粤人员通过粤康码等网络平台申报出行计划和健康状况，摸清底数，预判态势，切实做到心中有数和心中有招。各村居应急领导小组要制定疫情防控的应急预案，明确集中隔离点，加强
And we also need to come up with a contingency plan to strengthen the management of our people and also to conduct a series of drills. Recently, we're also coming out documents to strengthen our services for the civil affairs and also provide guidance to fever clinics. For all of these documents, please log in to our Provincial Health Commission to understand better about the situation. So I would like to talk about some of our assistance to Hubei. As of now, we have sent out 2,485 people to Hubei province. They will implement important guidance delivered by General Secretary Xi Jinping during his field trip in Wuhan City, and we will further analyze our situation of the epidemic fight, and we should say no to numbness, passiveness, and should not take chances and not slacken off in our efforts for the containment. So we need to ensure a detailed implementation of all the measures. At the same time, we have to enhance our care and help to the medical workers. As of now, no infection for our medical workers who are working on the front line.
现在有请龚国平先生介绍情况。各位媒体朋友，大家下午好。3月2日，习近平总书记考察了科研公关。
March the 2nd, General Secretary Xi Jinping have made a field trip to Wuhan and also they fully acknowledge the work done by the Department of Science and Technology. It is quite encouraging for the scientists and technology staff. On March the 6th, Secretary Li Xin has also organized a meeting to discuss the situation of science and technology, and he also emphasized that we have to focus on the scientific development and ensure to make a detailed implementation. Hopefully, we can come up more achievements to fight against the COVID-19. Recently, we have focusing on the containment of the prevention and control as well as the development of science and technology. First, we are using science and technology to facilitate the treatment. We're also focusing on the development of the vaccines. We are continuing to study on the epidemiology. We are focusing on 5 areas, mainly focusing on the clinical treatment. For our scientists, they have been working around the clock to focus on the development. We are providing more guidance to medical teams who are assisting Hubei province. We will continue to provide them support on the treatment by using the hydrogen and oxygen mixed gas. We also spare no efforts for the treatment of severe cases and critical cases. We are also making use of the plasma treatment to the patients. Also, we are using the TCM to treat the patients. We are also donating the TCM package to over 10 hospitals in Hubei province. In developing the vaccines, we are working with relevant departments to focus on the adenovirus vaccine as well as the recombinant protein vaccines. In the near future, we will use these vaccines for animal testing. For the R&D side, for the 16 approved reagents, 5 coming from Guangdong province. Also, we have 8 reagent test kits has been also included into the approval list at a national level. For the Guangzhou Medical University, they are also developing the throat swab machines so as can improve the sampling of the swab. For Guangzhou Regenerative Medicine and Health of Guangdong Laboratory, they are also coming out with the ACE2 animal model, and they are also providing a lot of support in the development of the antibodies. And the second, we are focusing on the development of the recycled and sustainable face mask. We have also working on over 100 sets of machines. Also, we have offered a lot of technical layouts for more than tens of technical companies. As of now, we have already coming out with many types of reusable face masks. All of these face masks can be used by the general public, and we could save some of the quantity of the use of the face mask. So for all of these reusable masks, they can be used for over 7 days. We also organize a team to go to the high-tech zone to understand the latest science and technology so that we can come up with more technologies to fight against COVID-19. We have also deepened our efforts in the area of financial areas. We are also providing more lendings to the science-tech companies. We have also waived some of the rental fees for some of the incubation companies. We also offer a 120 million year mark so that it can reduce the cost for R&D for all of these companies. We're working with different departments to move along the development of the science and technology in fighting against the COVID-19. We are also working together with the Ministry of Science and Technology. We're also working with over 2,200 companies for the R&D in this regard. For the provincial government, they have invested over 172 million to support the scientific and technological development in fighting against COVID-19. Together with the Provincial Health Commission, we have organized many meetings to discuss how to better use science and technology to fight against the COVID-19. Fifth, we have also worked with international organizations. For the Department of Science and Technology, we have already discovered over tens of reagent test kits. We have donated over 80,000 units of the test kits to other foreign countries. We're also dispatching an expert team to Iraq to establish a modular lab and to assist their medical rescue and treatment. For Guangzhou Regenerative Medicine and Health, Guangdong Laboratory work together with Zhong Nanshan Memorial Hospital They have also discovered an AI radiological machine, and these machines have already been used in the Jinyunkan Hospital in Wuhan City. And also we are working on some of the biomedicine. In response to the high-quality development, we will accelerate our speed for the R&D. Hopefully, we can come up with more measures in the near future. Hopefully, in the future, we can build more P3 labs so that to build an innovative and scientific park in our province.
谢谢龚国平先生。下面开始提问。
Thank you, Mr. Gong. Now is the Q&A section. Please identify yourself before you raise your questions.
前面第一排中间的这位记者。
谢谢，我是科技日报的记者，我想请问一下龚厅长，就目前
From
这个
Science
生物
Daily,
医药产业
my
发展
question
都
is
存
to
在这
Mr.
个广
Gong.
这些各个省它所处在的一个
We
普遍
do
的
see a
问
lot
题
of
现象。
weakness
那
in
我想
the
请问一下，广
development
东
of the
作为这个经济
biomedicine.
大省，还有科技强省，在生物医药创新方面呢，将如何发挥
So my question
政
is
策
that
引
for
领作
Guangdong
用？我们有
Province,
哪一些思路？还
so
有那
what
个
is the
考虑？
role for Guangdong
谢谢。
Province to leading the development of the biomedicine? Thank you.
通过这一次新冠肺炎疫情的防控工作，我们也发现呢，我们省的
For the prevention and control of COVID-19, we do found that in the areas of the biomedicine, we do have some weakness in the innovation of the
我
biomedicine.
们在疫苗研制和抗体研制过程
For
中，
example, in
要进行
developing the vaccines and the antibodies, we have to do a large amount of animal testing, but we do not have this kind of platform. We have to do this kind of test in other provinces.
公共卫生事件的染力保障我们人民群
In
众
order
的
to deal with the major public health emergency, we have to put people's health and safety as the top
那
priority.
么我们呢，
At the same time, we have to facilitate the high-quality development of the biomedicine.
尽快
We have to work with relevant departments of the province.
相关的政策措施。那么目
Hopefully,
前
we
呢
can come up with some measures to support the development of the biomedicine.
一是在关键
As of
核心
now,
技
we
术
have
供给方
considering the following 6 points.
我们要加强
First, in the supply of the core technology, we have
原
to
始创新，
provide
组
more
织实施
support
重
to
点
the
领域研
innovation.
发计划，大力开展
And
生
in
物医
key
疗
areas, we have further our plans for
新药
investigation.
创制
We have to
高端
provide
医疗器械
more
的技术研发。
vaccines and technological development of the medical equipments.
我们呢争取
And second, for the
建设
scientific
高等级的
platform,
生物安全实验室和大动物
we need to
同系列
build
研究
more
中心
high-level
强
P3
化
labs
再生医学
and
健康
the animal testing
与生物医药
platforms.
这两家省实验室的建设，同时来建设一批
So we will work
联
together
防联合实验室
with the
和
Guangdong
人常医学
Regenerative
研究
Medicine and Health to build
但是
a
在
Guangdong
理解
laboratory.
国内外高端创新资源方面，我们争取国家重
Third,
大的创
in
新资源
coordination of the
到
medical
我们省
and
来布
innovative
局落地。
resources.
同时，我们鼓
We
励
hope
国内
major
外
forces from across the nation can come to Guangdong Province and provide more support.
以及世界500强的药企来我省呢，
And we also encourage the key enterprises in the area of biomedicine come to Guangdong Province
建设一
to
批
facilitate our
特
work.
色的产业园区，
And in improving the supply chain, we would like to build more science park
创新链条，
to improve the
发展壮大生物医
incubation
药产
production
业的创新集群，同时呢，培育一批
so that we can
我是在人才保障方面，
facilitate the innovation in the biomedicine area. Fifth,
广东特质计
in
划
securing the talents,
培育和引进一批海内外高层次的创新团队
we will
和创新人
introduce
才。
more overseas experts
具有
and
国际影
talents
响
to
力
come
的
to Guangdong
顶尖
Province
人才团队到我们广东来开展研发和产业化。
We're supporting these people
六是在
to
科技伦理、
do R&D in Guangdong Province in biomedicine.
建立健全科技伦理的治理
In
体
the
系，
area of
实
biosafety,
行科技伦理的
we will
承诺
further strengthen our
加强
governance
科研诚信管理，
and we will also fulfill a
完善
commitment
生物医
mechanism
药
to
研究
manage
开
these
发的
people.
安全管理， 谢谢。
so that we can enhance the safety management for the biomedicine.
中间第一排的。
Next question, please.
实行科技实力的承诺制，加强。
我是中央广播电台央视记者。我的问题想问钟南山
With CCTV, my question is to Academician Zhong.
陆续都出现了境外输入的确诊病
In
例。
Beijing, Guangdong, and Shanghai, we do see some imported cases.
您有什么建议和提醒呢？谢谢院士。
So, do you have any suggestions in preventing those imported cases inflowing into mainland China? Thank you.
确实是这样的情况。
Indeed, that is the current situation.
统计了一下，大概有79例吧，
As of now,
输入的病例。
we have around 79 imported cases in mainland China.
都是零增长，所以在国内来看
In many provinces, we see zero increase of the confirmed cases.
联防联控这么一个机制下边呢，就是
I would say, with the joint efforts of the prevention and control,
比较好的控制。现在包括
the situation in China
基本上可以
is
说
controllable.
得到了控制。
Especially in Hubei province, we could see the situation is well contained.
把病人和正常人分开了，他们
And for the temporary hospitals, they have been separating healthy people and patients.
慢慢就转化到外头。
Now the situation is that we have more imported cases coming to China.
输入呢，现在看起来，往往他们并不是说有很多症状，就过
For these imported cases, these patients have not yet developed any symptoms.
发现，当然有一些是有症状，那么但是不一定有发烧。
And some people may have some symptoms, but they may not have fever.
在一开始，中国收集了将近1100例吧，那个病人的情况有点类似，也就是差不多50%。
This situation is quite similar with China at its earlier stage. At the beginning, we have gathered 1,000 or 100 samples. So for these people at the beginning stage, they do not have any fever, they are not having any coughing. However, for these people, when they are coming to China, they have developed some symptoms. So these people are not seriously ill when they are coming to China. So for some overseas countries, they may not attach enough attention to these people. So that's why these people continue to travel. So at this stage, we have to strengthen our surveillance to these people.
现在还没有，但是假如说真有一些比较大的这个位点的变异的话，那会产生更多的再感染的现象。
In the future, if we have an increased number of imported cases, probably we have to take some measures to control that.
对这些输入患者的管控。
At this stage, we have to properly manage these imported patients.
这个是这2天嘛？
As Mr. Liu Lei just said, in these 2 days, we have already found 4 imported cases in Shenzhen. These people are traveling from Shenzhen, from England. So for Guangdong province,
所以这个是
they have very close communication with the overseas countries. So we have to pay a lot of attention to the imported cases.
所以应该
And for these imported cases, in the end, they may become the source of infection.
刚给我的有一个就是境外重点地区新冠肺炎输入工作的这个一些防控的工作指引。我想这个还是要
I have just read one of the working guidance.
它有些就要求
I think we have to take all the necessary conditions into consideration.
的话呢，我估计这
For
个
some of the people who travel from overseas to China,
就是
these people have to be put under 14-day quarantine.
核酸检测，按我的看法，因为现在核酸
And
检
if
测
these
的
people have developed some symptoms, I think it's necessary to
这样的话，
run nucleic acid tests to these people, because now we could see the accuracy of the NAT is improving. So if we run these tests to these patients,
需要做什么
it will bring good to these patients as well as the mainland.
这个是第二。
At this point, we have to strengthen our communication to the overseas countries, so communication holds the
国
key.
家的沟通，在欧洲呢，这个
As of now, I have already held many times of conversation and also have a video conference with European Respiratory Association and tonight, and also have another video conference with overseas countries. I also work with experts from Japan, Singapore, Italy, and our compatriots from Hong Kong. So actually, the perspective is quite different from different countries. In China, for less than 2 months, we have already accumulated some experiences. So it is very important for us to work with other countries so that we can identify the effects of some of the drugs. Because the COVID-19 was first identified in China, so it is very important for us to pass on some of our experiences to other countries. In this way, we can reduce the mortality rates in other countries. As of now, I could see there are over 40,000 people across the globe was infected with COVID-19. And the mortality rate is really high. I think the situation is quite similar to Wuhan at the earlier stage. At this point, we have to raise the awareness to the medical workers as well as the people in those countries. And I'm also aware that the northern part of Italy also adopted a lockdown approach. And yesterday, we have some experts and medical workers from West China Hospital to travel to Italy to offer some guidance and suggestions. I think at this point, it's very important to strengthen the communication between the two countries. It is not practical to come up with a specific drug to treat COVID-19 in less than 2 months. SARS broke out 17 years ago, but till now we have not yet come up with a specific drug or vaccine. So it takes time for us to do some R&D on COVID-19. In China, except for Wuhan City, the mortality rate in other provinces is actually less than 1%. So on one hand, we have to strengthen our internal management. At the same time, we have to work with the medical workers in the other countries, so these people's awareness can be raised. By doing all of that, we can help the world to win the battle against COVID-19. So even though eventually the epidemic can be contained in China, but we have a lot of international cooperation. So that's why we have to offer a helping hand to those overseas countries. As WHO has just identified that the situation right now is at a pandemic level. As the WHO have made that declaration, meaning that all the countries should take necessary measures to protect their own people. I think during this process, China can play a bigger role to offer more support to other countries. Thank you. Next question, please.
谢谢主持人，我是香港凤凰卫视记者张希。我的问题是提给这个
Phoenix.
院的林院长。我们知道，刚刚龚厅长他在发布的时候有专门提到这个新冠肺炎 AI 的诊断的这个系统。
My question is to Mr. Lin. As Mr. Gong just mentioned about the AI treatment system, so can you tell us more about this system to treat the patients with COVID-19? Since the outbreak of the COVID-19, I think it is very important for the medical workers to diagnose and treat the patients. However, in the past, we have some restrictions and limitations. So based on our experiences, we think AI can provide more support to the medical workers for further diagnosis and treating of the patients. We have some radiology big data, and also we are making use of the AI technology, so that we have come up with the AI medical support system for the X-ray scan. So by making use of this kind of equipment, we can ensure the accuracy of the diagnosis. In the past, one doctor may take 15 to 20 minutes to make a diagnosis. However, for this supporting equipment, it can make a diagnosis within minutes, and the accuracy rate can reach around 90%. And for this support system, it can classify the severity of the symptoms. This system can scan all of the X-rays and also differentiate the severity of the diseases. For example, it can identify the abnormal chest CT, the GGO, as well as the infiltration. And also by using this AI supporting system, we can further understand the body condition of the patient. So if we are using this AI supporting system, we can also make a judgment that whether the patient will be deteriorated into severe condition. By using this AI supporting system, we can also reduce the mortality rate of the patient. The AI support system can also analyze the CT scan for each one of the patients and to analyze the current physical conditions, and also can offer some suggestions for the medicines. We have already applied this AI supporting system in the 3rd Renmin Hospital of Shenzhen, the Sun Yat-sen Memorial Hospital of Sun Yat-sen University. And we are testing this system, and going forward, we will roll out the use of this AI CT scan supporting system. And in the future, we can also offer this technology to overseas countries. Hopefully, this new technology can support the fight against COVID-19. And hopefully, the supporting system can make the contribution to containing the virus from spreading outside of China. My question is also to Mr. Liu Lei. So my question is about a microscope R&D initiative in Shenzhen. So can you tell us more about this new technology? Since the outbreak of the COVID-19, the 3rd Renmin Hospital of Shenzhen has established an R&D team to deploy on the scientific and technological work. So we are separating the strain of COVID-19 in one of the PC laboratory, and also we identify the virus at an earlier date. And also we are coming out with a very highly concentrated virus strain through our technology. So we actually capture different stances and the pathology of the virus in our separation of the virus. It's the first time that we understand the pathology of the virus. And this also offers a solid foundation for us to further understand the virus, and also it will help us to further develop the vaccines and specific medicines. So for this kind of electric microscope can identify live proteins as well as the virus. And this kind of technology can also be applied to different fields. So for this microscope can also identify the original stems of all of these virus and the particles.
谢谢主持人，我是香港南华早报的记者归瑞。我的问题是提给钟院士。您刚才也提到已经
My question is to Academician Zhong. You have just mentioned that WHO has identified the current situation as a pandemic. So what is your view on the epidemic situation in other countries? As of now, we could see a fast spread of the virus. So what kind of experiences can be used in other countries? Thank you.
刚才讲的比较多的呢是技术方面的以及知识方面的。现在
Earlier, we just talked about some of the knowledge and the technology, and you are now talking about international collaboration.
我记得当时的评估的话呢是，要基于就是很多国家都能够，应该像我们国家那样能够。
My earlier estimate is that the virus can be completely controlled and contained by the end of June, but it is under a precondition is that some countries need to attach great importance to the spread of the virus. I believe some countries have done a good job, but it is not for all the countries. So we have seen a dramatic surge of the cases in many countries. So the peoples of those countries will not consider the coronavirus as a regular flu. If other countries can take proactive measures to contain the epidemic, then the virus can be controlled by the end of June. However, if some countries underestimate the severity of COVID-19, so maybe the containing efforts need to be further strengthened. In summer, if the temperature gets higher, maybe the virus will kill itself. However, we all believe COVID-19 will bring impact to different areas of the society, and also it will impact the economy. So in the past, my evaluation and assessment is focused on China. But now the WHO has identified the current situation as a pandemic. So it means that each country needs to take necessary measures to control the virus. And in Italy, I realized that the mortality rate has reached 6%, meaning that all of a sudden a large number of cases emerged. So this question is also in relates to medical resources and also the medical intervention to the COVID-19. So that means that all the countries need to attach great importance to the containment.
包括美国、包括法国、包括西班牙这些。
The mortality in Italy is very high, but
美国也很高，2.7。
I also realized that in the US, France,
所以
Spain,
这个看起来就是
the mortality rate is also between 2 to 3%.
够的这个。
So I think at this stage, these countries
在中国的这个
need to focus on COVID-19 and take necessary
但
measures.
实际上差别太大了。在武汉类和湖北类。
In China, the mortality rate is 3%, but it is just the average.
在湖北境外
If we look at the mortality rate in Hubei,
以外的省
it is over 4%. But if we look at the mortality rate outside of Hubei province, the mortality rate is really low. This is thanks to a strong prevention and control work taken by the local
这
governments.
样我说，就呼吁各个国啊，响应的联合国世界卫生组织的这个呼吁。
My suggestion is that all the countries respond to the call of WHO so that they can come up with a national level strategy to fight against the epidemic.
我是很高兴，意大利现在做搞起来了。
If all the countries can mobilize their resources to fight against the epidemic, I believe the situation will improve.
我还是期
So
待
you could see in South Korea, the situation gets a little bit better. So if that is the case, the epidemic can be controlled by the end of June.
左手边第一排来，中间那位啊，
开始下降。
我是中国日报的记者，想问一下吴光明研究员。
With China Daily, my question is to researcher Mr. Wu Guangming.
的这个模型，想
You
请
have
介绍
just
一下
talked
这个
about your
手法
lab has also established a rat model, an animal model.
领先的地方是体现在哪
So can you tell us more about the advantages of this animal
新冠
model?
病毒是通过一种酶，简称 ACE2 来感染人类。小鼠呢也有这个酶，只是和人呢有比较大的差异。
So actually, the COVID-19 was transmitted with an enzyme called ICR. We also found this kind of enzyme in the mice.
可以较快的获得易感消暑。但由于人的 ACE2 基
So
因
by
呢是
using
随机插
rats,
入
we
的
can
在组织中表
imitate
现
the
非
situation,
性很难控制。
so we can understand the transmission of the virus through the
多样
rat.
化的含义就是把动物源呢换成
That's
人源
why we are establishing this animal model to further
用人的
understand
ACE2
the
基因替
virus.
换掉了小鼠的 ACE2 基因。
So we are using the ICR gene from
新
human
冠病毒易感
to
我
ICER
们这个
gene
ACE2
of
人源化小
rats.
鼠经过鉴定，确认在肠道、肺、肾等多个组织器
With
官
further
中
testing, we found that in lungs,
比较影响
testing in testings,
至于我们这个
all
技
of
术的
these
先进
areas
性
will be
我想主要
infected
就是速度
by the
快
virus.
常规的
As
人源
for
化
the
小鼠制作
advantage
需
of
要
our
半年
technology
的
is
时间
that
如果什么
we
都
have
不有
accelerated our speed
恰巧我
to
所在
set
的
up
这个
this
非
animal
疱疹
model.
中心是做干细胞前沿基础研究的，经常考虑快速制备小鼠模型的问题。这次疫情，
So in my laboratory, we are focusing on establish the
快速大量
animal
生产
model.
人源化小鼠的技术方案。这个方案如果成功，将大大缩短制备时间。
If we can use this
1月31
animal
号
model
技术方案开
effectively,
始
it can help us to
到3
shorten
月6号
the hospital stay for the patients.
出生，仅用了35天。
It takes us less than 35 days to set up this animal model.
技术已经很成熟，我们之所以这么快，主要是因为加入
We
了
have
我们
very
独有的
mature
4D
technology
长
to
技术
build up this
我们
model.
说该技术制作小鼠的效率可以达到30%到60%，大幅领先国际
The
上报道的
efficiency of building such a animal model is up to 30 to 40%.
和斯贝里土床技术相结合后，可以同样快速高效制备其他人源化小鼠模型，对今后
Also, by using this kind of cells,
项目具有重要意义。该小鼠是研究新冠病毒感染机制、药物筛选和疫苗开发等领域的理想动物模型，有助于解决当前缺乏有效的规模化的新冠肺炎动物模型的困境。所以，我们后续将大量生产构筑
problems that
抗
we
疫
are facing in
科研
setting
工
up
作的
the
一线
animal
战场，
models in fighting
为打
against
赢疫情防控
COVID-19.
战争贡献一份力量。
So we will work together with the Department of Science and Technology so that we can contribute our efforts in winning the battle against COVID-19.
你好，新华社记者，想问一下龚厅长，然后近年来我们知道那个广东围绕这10个重点领域，我们就是打造了一批高水平的实验室。然后请问一下龚厅长，就是广东的省实验室
Guangdong has focusing on established high-quality provincial laboratory. I want to understand the provincial laboratory's role in fighting against COVID-19. Since the outbreak of COVID-19, for the provincial laboratory, we have made rapid response, and we give full play to our human resources, equipment, and we have achieved notable progress. This can also help us to win the battle against COVID-19. As of now, led by academician Zhong Nanshan, with over 10 academicians, the provincial laboratory work together with laboratory with Hong Kong, Macau, and Guangdong province. We all engage ourselves in science and technology development. We have made a lot of contribution in rapid testing, equipment R&D. We have also achieved over 50 outcomes in this regard. This can help us to strengthen our prevention and control work in the epidemic as well as the clinical treatment. Led by academician Zhong Nanshan, the academician group, they have done a lot of studies in rapid diagnosis, animal tests, as well as the nosocomial management. Their contributions have played a lead role across the nation. In early February, we have also successfully separated the COVID-19 virus. And also we are separating the virus from the feces and the urine from the patients. This is very important to help us for the prevention and control of epidemic. And also we are making a lot of contributions. For example, the development of the hydrogen, oxygen mixed gas. All of these can be included into national diagnosis and treatment guidelines. And also, we are making some progress in developing the mRNA vaccines. And also, we are working with the Zhong Nanshan Memorial Hospital. We are starting an investigation on the clinical analysis of the patients. One of the medicines has been included into the 6th edition of the diagnosis and the treatment guidelines. For our laboratory, we are also doing a lot of R&D for specific drugs. Also, we are working on an AI supporting equipment to analyze the CT scans of the patients. So for this AI CT scan supporting system was developed together with the Zhong Nanshan Memorial Hospital together with the Guangdong Regenerative Medicine and Health Laboratory. And earlier, WHO forward team have made an inspection for the Guangdong laboratory. They fully acknowledge our work in contributing to COVID-19. We are making full use of AI and big data and study on the pathology of COVID-19. We also use with other laboratory to develop the reusable facial mask. Thank you.
谢谢主持人，我是财新传媒记者黄硕。这个问题我想问钟南山院士。钟院士，您因为目前核酸检测应用于新冠病毒的确诊和出院，请问您的团队
Now we are using NAT to diagnose and treat the patients. So you are also using a throat swab to diagnose the patients. So can you tell us more about the newly developed throat swab? So actually, for taking the samples is very risky because we also see some transmissibility from the virus during the sampling process. So I think during the sampling process, first of all, we have to protect our working staff. And second, we need to set up some standardizations for the sampling. In the past, we found that the accuracy of NAT may not be 100%. That's why we are using some of the throat swab and the nose swab for the sampling. By doing that, we can improve the accuracy for the sampling. Now we have done sampling for over 10 people. And we also analyzed the number of cells that we have been collected from these patients. And going forward, we will continue to investigate into the accuracy of the sampling. We also have to benchmark the sampling together with our standards and regulations. However, all of this needs further verification. But at this point, I think the nucleic acid testing is the major way to identify the COVID-19 virus. Due to the interest of time, that is the end of the Q&A session. Well, I have some comments to add. So many people, after they're being discharged from the hospital, when they're taken the NAT again, feels that these people back to positive. I believe the general public attach great importance to this phenomenon. And recently, we have done a lot of investigation into that issue. For the NAT test, it's actually focusing on the testing of the segment of the nucleic acid. So if a patient have met the discharge standards, meaning that they are tested negative in their nucleic acid, and these people were discharged, and they have no symptoms. However, if these people tested positive again, does that mean these people has to be sent back to hospital? That's not what I think. I think this happens on some time, and also it will affect a large number of people, including the patients and family members of these patients. I believe for most of the patients, they have already developed the antibody, which is the IgG antibody. And this IgG antibody can help to kill the virus. So for a majority of people, it is unlikely that they will be infected again. However, for some individuals, maybe they have not yet recovered, they have not yet reached the standard of a clinical recovery. For some indexes, if these patients are not up to the standard, meaning that they have not yet recovered. So people are paying a lot of attention to the close contacts for these patients. So for example, if these people tested positive again after they are being discharged, does that mean these people will be infected again? And shall we take all of those close contacts back to quarantine? But as of now, we didn't see any close contacts being infected again. And also, I have some conversation with the expert of Hong Kong Margaret Hospital. He actually did a lot of experiments. He also found the coronavirus positive was for some of the recovered patients. He detected some of these virus and to see whether some of those virus are still positive or live. So none of those virus were active. Because we are quite worried about that, whether these people are still contagious. So meaning that if they have active virus, then these people may pass down this coronavirus to others. So I think if this recovered patient tested positive again, we have to do more analysis on that to see whether we should bring these people back to hospital or to bring the relatives to quarantine points. So I think after these people being discharged, we need to run more tests to these people. If they have a high level of antibodies, so I think we do not need to worry too much, but we have to closely monitor the situation, because if one of the patients was infected again, then these people will pass the virus to a large number of group of people. We have done a lot of work. Also, some of my colleagues are doing a lot of work on that. So I think as of now, we have not yet detected any active virus. At this point, we do see any sign of transmission. Due to interest of time, that's the end of the Q&A session. And tomorrow we will invite more experts from the health commissions. If you're interested, please submit your questions to the information office of Guangdong province, and we will reply to you in a due course. Thank you again for all the speakers and the journalists. Thank you.